Hello everyone, my name is Jocelyn, you may call me Joy, and this video is going to be about vaccine mandates. Now, I want to make it perfectly clear up front that I am in favour of vaccines, not just in general, but also for the specific reason that's been happening for the past 2 years. However, I do think that this topic still requires talking about and addressing because, look, I'm in a bit of a grey area when it comes to my conclusion on all of this. So I want to let other people know that it's okay to feel ambivalent, and if anybody else can, provide resources reassuring me or those other people, that would be great. Obviously, I'm not going to be okay with promoting any anti-vax, like full-on conspiracy stuff. That's not what I'm about. But now that I've got that out of the way, I want to first bring your attention to an article from The Guardian describing the UK government doing what the UK government tends to do best, which is U-turns. It says, ministers have announced plans to scrap an order forcing all NHS staff in England to get vaccinated against COVID in a U-turn that will prevent an exodus of thousands of frontline health workers. Sajid Javid, the Health Secretary, confirmed the move in a statement to MPs on Monday evening, ditching a policy that he had championed in spite of growing concern that it would endanger patient safety by triggering the loss of key personnel from the already understaffed health service. Do note that Saj is a Conservative, and slashing the NHS to pieces is the second thing that they do best. The move came 3 days before the 3rd of February deadline that unvaccinated NHS workers who had face-to-face contact with patients had been given to have their first dose or be dismissed. Figures published last week by NHS England showed that 127,515 NHS and domiciliary care staff working in registered settlings had not had a first dose of COVID-19 vaccine as of the 23rd of January. That's this year, 2022. There were 92,368 positive cases recorded on Monday, as well as 51 deaths. The 7-day rolling number of cases was down 5%. Javid also plans to remove immunisation as a condition of working in care homes, an approach that has already led to the loss of about 40,000 staff in that sector. He told MPs, while vaccination remains our very best line of defence, I believe it is no longer proportionate to require vaccination as a condition of deployment by statute. I will launch a consultation on ending vaccination as condition of deployment in health and all social care settings. Subject to the response and the will of this House, the government will revoke these regulations, he added. NHS organisations said that an estimated 60,000 staff would have been dismissed if Javid had not relented. The fact that Omicron variant of the coronavirus is much milder than its predecessor Delta and that a large majority of the population have been fully vaccinated justifies the change, Javid told MPs. Sir David Nicholson, the chief executive of the NHS in England until 2014, summed up the frustration of many of the healthcare service bosses about the 11th hour reversal when he said, "It's hard to imagine a greater shambles." Now, I know that a similar conversation is happening in the US right now, so this does apply to a lot of people. But I'm just using this as an example because it's where I live. It affects me the most, even though it doesn't affect me specifically because I'm not a healthcare worker. So, let's break this down. The plan originally was to mandate the vaccine for all healthcare workers or else they lose their jobs. Now, of course, the backlash is that such a move is untenable and impractical because of all the staff that would be lost, and I can't help but agree with that. But assuming that there is no legitimate reason for not having the vaccine, e.g., an allergy or being immunocompromised or anything like that, like an actual legitimate reason, it does kind of raise the question, well, it kind of raises a lot of questions about why were these healthcare workers unvaccinated? Like, should we, the public, even trust them and, their healthcare providing capabilities if they refuse the thing that is medically sound, the, best advice that we have from the medical experts? Are they not following their own advice for some reason? And I don't want to take away personal agency from these people. It's just yet another thing that feeds into the narrative of conspiracy theorists, which is dangerous. The defense that's always brought up is about the individual's rights. They like to frame it as my body, my choice. Okay? And okay, that's a thing when it comes to, say, reproduction rights. But what about my right and everybody else's right to not get infected with this disease that's been going around? And I don't care if it's less fatal than the other strain. It's still dangerous and it's still deadly to some people. What I'm trying to say is, and I will paraphrase from another YouTuber that I follow called Telltale, is that your right to swing your fist ends at the tip of somebody else's nose. But even so, even with that said, I still don't believe that a vaccine mandate is the right way to go about remedying the situation. I do believe that everybody should be vaccinated if they can be. Again, the sane and very real, legitimate reasons, exclusions apply, the ones that I mentioned earlier. But again, this whole mandate thing feeds into the conspiracy theorists' rhetoric of, being compelled to get the vaccine. And again, giving those lunatics, those conspiracy theorist believers, any sort of power is dangerous. Because what they say spreads. It's got nothing to do with government control or, various other reasons that I'm not going to say out loud because the YouTube bots pick up on these things and then strike people's channels. Even when they're not promoting these things, they are just talking about, mentioning, debunking these things. I hope you understand and get a little bit of a chuckle. The reason that the conspiracy stuff surrounding vaccines is so dangerous is because it's encouraging others to defy the wisdom of the protection that vaccination gives, whether the government wants you to or not. You know what I mean? Like, yes, the government has an agenda. We shouldn't forget that. But sometimes they say things that are correct, and unfortunately they are subject to their own boy who cried wolf syndrome just a little bit too much. They've lied and cheated their way into the system so that they are now at the top and in control. So why would anyone believe them after years and years and decades and centuries and practically millennia of governments and political power being used as a weapon against the masses? But beyond that, I'm still not sure how I feel about vaccine mandates. I'm on the fence because while I do want to promote people getting vaccinated, and for this specific, reason, this, whole coronavirus thing. I've had 3 vaccines now. I've had COVID a number of 0 times, which is great. And I want to think that if I get it, that I am going to get, that I'm going to be protected from the worst of the effects. It's just that a mandate like this is really bad optics. Trying to prove that you're not the authoritarians whilst doing authoritarian things is not going to convince anyone to your side. Now, a better approach comes from another YouTuber that I have mentioned a couple of times. Yes, I still absolutely worship-ish. This is Kyle Kulinski's idea, and he says that rather than punishing people for not getting the vaccine, the government and everybody who is in favour of vaccines should be seeking to rewarding people who do and who have been vaccinated. Sometimes you need a stick, sometimes you need a carrot. But anyway, that's all from me on this topic. Please let me know what you think. And as always, non-binary is hecking valid, goddammit. Bye!